I'm in the medical intensive care unit of Cochin Hospital in Paris about the prevalence, the risk factors, and prognosis of acute kidney injury after cardiac arrest. I have no conflict of interest. And as a background, we have to remind that post-resuscitation disease, post-resuscitation shock, is related to a multi-organ ischemic reperfusion injury, leads to a multi-organ failure, and in this multi-organ failure, you can consider that kidney may be involved. And kidney may be involved in, via multiple mechanisms, as ischemia reperfusion, of course, but also acute tubular necrosis, because those patients are shocked, because those patients are injected with iodinated product. The objectives of the study was to describe epidemiology of acute kidney injury after cardiac arrest, to pick up risk factors of acute kidney injury after cardiac arrest, and to evaluate prognostic impact of AKI. And to achieve these goals, we made a single-center study, and we included all consecutive patients admitted after cardiac arrest in our ICU between 2007 to 2012. And we excluded patients with any previously known chronic kidney disease, any unknown ethnic origin for MDRD calculation, and patients who were dead on arrival. Data were prospectively collected according to Hochstein style, and we adapted international definitions for cardiac arrest patients, and you can see here that we consider acute kidney injury if urine output was less than 0.5 milliliter per kilogram per hour within the 6 first hours. So if admission creatinine higher than 1.5-fold creatinine using MDRD equation, if renal replacement therapy was still necessary at day 3, and if maximal creatinine during the first 48 hours was higher than 1.5-fold creatinine. And as a statistical analysis, we performed especially logistic regression, including Hochstein factors, and we evaluate factors associated with acute occurrence, associated factors associated with day 7 and day 30 mortality, and we performed also a sensitivity analysis with international AKIN definition. So, during the study period, 906 out-of-hospital cardiac arrest patients were admitted in our ICU, and we finally included 802 patients after we excluded 39 patients with chronic kidney disease, 38 patients from unknown origin, and 27 patients dead on arrival. And here are the baseline characteristics of these 802 patients. They are mostly males in 70% of cases, with a median age of 61 years. Cardiac arrest occurred in public place in 1/3 of cases and was related to an initial shockable rhythm in half of cases, with a median time from collapse to rosc of 21 minutes. Cardiac arrest was witnessed in 87% of cases, and the bystander cardiopulmonary resuscitation was performed in half of cases. And when you look at the baseline renal characteristics, you can see that the median admission creatinine was 104 micromole per liter. It's similar when you consider the median maximal creatinine during the first 48 hours, and the median 6 first hours urine output was 1 milliliter per kilogram and per hour. Renal replacement therapy was considered in half of cases and was still needed at day 3 in 13% of cases. Remind that iodinated contrast was used in our diagnostic strategy in 3/4 of patients. Regarding to the ICU management of these patients, coronary angiogram was performed in 67% of cases, CT scan in head CT scan and chest CT scan in 55% of cases. Cardiac arrest was related to a cardiac cause in half of cases, and the post-resuscitation shock was observed in around 60% 5% of cases, with a median admission lactate level of 5 millimole per liter. Therapeutic hypothermia was performed in 86% of cases. And look at the outcomes here with the D7 mortality, which was 46%, and D30 mortality, which was 66%. Well, when you look at the prevalence of acute kidney injury in our study, among the 802 patients included, we observed 312 patients with acute kidney injury, as nearly 40% of patients. And when we looked at factors associated with acute kidney injury, here is a multivariate logistic regression, and you can see that age, time from collapse to rosc, and post-resuscitation shock were associated with acute kidney injury in occurrence, whereas an initial shockable rhythm was negatively associated with acute kidney injury occurrence with an odds ratio of 0.62. Regarding to the outcome at day 7, for patients with acute kidney injury, at day 7, 116 were alive, and 196 patients were dead. And in patients without acute kidney injury, 177 patients were dead after 7 days in ICU. And here is the forest plot with, for the multivariate analysis of factors associated with day 7 mortality, and you can see that acute kidney injury was independently associated with day 7 mortality. Post-resuscitation shock was associated with day 7 mortality as well, and therapeutic hypothermia and an initial shockable rhythm were, in the other hand, as negatively associated with day 7 mortality. Regarding to the outcome at day 30, where if patients were alive at day 7, 52 patients with an initial acute kidney injury were alive at day 30, and 64 patients were dead at day 30. And for patients without acute kidney injury, 217 patients were alive at day 30, and 96 patients were dead at day 30. And we made the same analysis for day 30 outcome, and you can see that acute kidney injury remains independently associated with day 30 outcome, and post-resuscitation shock as well. To consider international definitions of acute kidney injury, we used acute kidney injury network definition, and you can see that we observed the similar results with Akin classification. And when you are stage 3 of Akin definition, the adjusted odds ratio of day 7 mortality was 2.81, and it was 3.61 for adjusted odds ratio of day 30 mortality. Regarding to the renal outcome of patients with an initial acute kidney injury and who are discharged alive at day 30, we consider 52 patients, and among those 52 patients, 30 and 5 patients returned to their baseline creatinine level. And among patients with a renal function decrease after cardiac arrest, we observed a median increase of creatinine level of 36%. In our study, only 1 patient still required renal replacement therapy at day 30. As a conclusion, in our study, acute kidney injury occurred in more than 1/3 of cardiac arrest patients, and we observed that factors associated with acute kidney injury were an older age, a post-resuscitation shock, and the duration of resuscitation efforts. We also observed that acute kidney injury was independently associated with short-term mortality, day 7 and day 30, and should be a target of treatment in the future. Thank you for your attention.